introduce our PICO question. So our population is the postoperative patient that is being treated for pain. Our intervention is the combination of non-pharmacological and pharmacological interventions together used to treat pain. Our comparison is the combination of pharm and non-pharm interventions versus just pharmacological interventions in treating pain. And our outcome is the effective reduction of pain with the use of the combination treatment, and our timing is throughout the stay of the hospitalization of the postoperative patient. So what's the importance of our PICO question? Well, whether you work on med-surg floors or any other area of the hospital, more than likely you're going to be dealing with a patient that is postoperative at some point or another. And postoperative patients usually have a hard time handling their pain and keeping it under control. Well, the evidence given from the studies used shows that non-pharmacological and pharmacological interventions used in combination are better at significantly reducing the pain in a postoperative patient rather than just pharmacological interventions alone. And why is that important? Because when we are better at reducing a patient's pain, they are in a better mood, they're more likely to do their physical therapy or whatever it is they need to do in order to heal. They move quicker, which the evidence shows that patients are better when they move within the first 12 hours after surgery. And they are able to focus on their healing and on getting better from their surgeries.
Hi, my name is Safira Just, and I'm going to be talking about the articles that we used in our project. So based on the findings table, non-pharmacological pain interventions were efficient when combined with pharmacological pain interventions. The articles reviewed in the findings table all commonly came to this conclusion. The article titled "The Effect of a Pain Management Program on Patients with Cancer Pain" was a qualitative study in which the findings demonstrated that the use of PRN medications as well as the use of non-pharmacological methods were effective in reducing pain. It also explained how education in pain management was used as well and how the education was effective. The search terms we used were postoperative, pharmacological, and non-pharmacological, and 19 articles were retrieved. The next article we used was titled "Guided Imagery for Adolescent Post-Spinal Fusion Pain Management, a Pilot Study." And it was a randomized clinical trial. The experimental group, which received non-pharmacological interventions in combinations such as guided imagery, relaxation, and education, demonstrated decreased pain than the control group. The anxiety levels for the experimental group were also lower within the first month. The terms we used were guided imagery and postoperative, and 4,059 articles were retrieved, and it was article number 2 on the list. In the article about auricular pressure by Chen, an experimental study was conducted. Patients who underwent lumbar spine surgery were used in this study. The combination of auricular acupressure and transcutaneous acupoint electrical stimulation reduced pain anxiety, and the use of morphine reduced nausea and vomiting. The search terms we used were postoperative and pain, and 1,074 articles were retrieved. The article was number 18. The article titled "Patients and ICU Nurses' Perspectives of Non-Pharmacological Interventions for Pain Management" was performed using a qualitative descriptive method. Patients in the ICU used non-pharmacological interventions such as music therapy and distraction, simple massage, and family presence. The non-pharmacological interventions were found to be useful in reducing pain in the patients. The search terms we used were non-pharmacological, postoperative, and pain management, and there were 2,381 results. The article was number 9 on the list. The article titled "The Feasibility and Acceptability of Hand Massage Therapy for Pain Management of Postoperative Cardiac Surgery Patients in the Intensive Care Unit" was a qualitative design method, and it was used on post-op cardiac patients in the ICU. An opioid dose was given prior to treatment to determine the effectiveness of the treatment. Many patients who received the hand massage deemed it as appropriate, while others believed that different dosages or different areas of the body where the treatment was done could have produced better results. The search terms we used were therapy and pain management, and there were 678 articles retrieved. The article was number 18. In the next four articles by Bergomi, Comio, Ecomido, and Keebler, these all demonstrated how specifically music therapy combined with pharmacological therapy were effective in reducing pain in patients. In the article about non-pharmacological techniques to reduce pain in preterm infants, music by Mozart was effective in reducing pain in infants compared to those who did not receive this therapy. The key terms used were postoperative, pharmacological, or non-pharmacological, and 19 articles were retrieved. In the article titled The Effect of Complementary Music Therapy on the Patient's Postoperative State Anxiety, Pain Control, and Environmental Noise Satisfaction, music therapy was found to have a significant difference in patients who received this therapy compared to those who did not. Pain was better managed when music therapy was used. The search terms we used were postoperative pain, music therapy, and 4 articles were retrieved. In the article about how adolescents perceived music therapy, a qualitative study was used and patients were asked to rate their pain from 0 to 10. They stated that music therapy did help with their pain reduction, and the search terms we used were music therapy and postoperative, and 3,853 articles were retrieved. In the article titled Does Music Reduce Postoperative Pain and Review, a systematic literature review was conducted. We used the keywords postoperative pain and music therapy, and 4 articles were retrieved. We determined that this article was the most informative, and well conducted.
Hello, my name is Havan Abraha, and today I'm going to talk about the articles that we appraise. The title of the article we chose to appraise is Does Music Reduce Post-Operative Pain? And we chose this article because the design used was a systemic literature review, which is the highest in the hierarchy of evidence. For the synopsis, in conducting the literature review, 4 people were involved, and the topic that was addressed in the review includes whether music therapy reduces post-operative pain or not. The individual reports are retrieved from databases such as CINAHL, Midline, Embase, and Cohan Library. The inclusion criteria include titles and abstracts with music therapy in post-op, English language, and the availability. The exclusion criteria includes reviews of articles, studies with qualitative studies, and studies that did not include music in the intervention, and those who use combination of music with other methods such as relaxation. Overall, 6 articles were reviewed in the studies. The research designs used in the studies are the 5 ones are the randomized control trials and 1 double-blinded control trial. The important conclusion drawn from the 6 studies is that music had reduced post-operative pain, and the pain level was measured using a visual analog scale. For the credibility, the article is credible because it has a clearly stated topic, which is music therapy can reduce post-operative pain. The search for the studies was comprehensive and unbiased because they used databases like CINAHL, Midline. The screening citation to select studies for the inclusion criteria was based on expletive criteria, since all studies were approved by the local committee, and an informed consent was obtained and provided for the all inclusion and exclusion criteria. The included studies were accessed for quality because in all the studies, randomization was clearly described mostly, which was done by a computerized generated randomization list. The design characteristics and findings of the included studies displayed sufficient detail, and this is seen in Table 2 of the article. And for the clinical significance, the article is clinically significant because the findings are strong enough to be used in a clinical practice, since each study focuses on the findings that we are analyzing using statistically significant p-value. And in all studies, the p-value was less than 0.05. And this infers that there will be no difference in the population. And since the 886 patients undergoing elective surgery under general anesthesia were analyzed in the studies, it can be said that the sample is large enough to draw a conclusion that music therapy will reduce pain when combined with pain medication. And for the applicability, the article is applicable in hospital settings because music therapy is inexpensive and non-invasive. The patients in the studies are similar to the patients that I see in the hospital settings every day. Most of my patients are post-operative patients that have pain, so music therapy can help reduce their pain. The limitation of the articles were that there was no demographic data that was provided. And I would like to implement a clinical protocol that encourages nurses to implement music therapy as part of their pain intervention, since music therapy is a non-invasive and cheap intervention. Synthesis of the evidence. The literature showed various ways of non-pharmacological in combination with pharmacological treatment in reducing post-operative pain. The literature supports the idea that all pharmacological intervention can be used in general sense for all post-operative patients in combination with pharmacological. We started with the topic of pain and reducing pain, mostly concentrating on possible comparison between IV medication versus oral pain medication. But there was no literature evidence that supports our topic. Then we came upon the idea of using pharmacological intervention. We mixed it with non-pharmacological intervention to reduce pain. So our PICO question supports our literature review.
Hey everyone, my name is Malini, and today I'm going to be talking about our project proposal. So, with our research, we found that non-pharmacological pain relief methods in combination with pharmacological pain relief methods actually work better to help relieve pain by relieving anxiety and helping the patient to heal faster when compared to just pharmacological pain relief methods. So, our project proposal is to research the use of music in combination with standard post-op protocol in regards to analgesics to see if that affects post-op pain. And we also want to see if the type of surgery that the patient had any effect on the outcome. So we would conduct a study in a PACU setting in a Pacific hospital where the number of surgeries are numerous and the types of surgeries are various. We want to generate a sample size from our power analysis, and we will try to conduct the study for at least 1 month or until we've reached our number that was generated from the power analysis. The way the experiment's going to work is that the day the patient goes to surgical interview, we would select patients that were having the same kind of surgery around the same age and had the same amount of comorbidities and group them into pairs. This way it would eliminate extraneous variables and also be easier to compare. We would obtain written consent from the patient from a written consent form that we would give to the patient, and then we would also explain to the patient what the experiment was about. We would tell them that this was an experimental type of study and they would be randomized, and obviously they wouldn't know until the day of the surgery whether they were in the intervention group or the controlled group. Also, we would have the patient write down what type of music was most appealing and most calmest to them on a form that we would use this music as the intervention in our experiment. On the day of surgery, we would brief our staff nurses on what they were expected to do as far as the intervention goes, and we would brief them on what they were to do for the control group, which would just be the regular standard protocol. The nurse would be assigned pairs of patients that she's going to be taking care of, and she would randomly assign which patient she's going to be doing the intervention on and which one she's going to be doing the controlled on. She's going to do this by picking names that we've written on a piece of paper and folded into a glass bowl, and she would pick names out of the bowl. Whichever name she picks first is the one that she's going to be doing the intervention on, and then obviously the second is what she's going to be doing the controlled on. And each nurse would then be provided with iPods for that specific patient that she's doing the intervention on, with music that was already pre-downloaded that the patient selected was their favorite genre of music that made them the calmest. The nurse would be initiating the intervention after 30 minutes of post-op. The patient would have already received their standard protocol of analgesics, whether it was morphine, fentanyl, Dilaudid, Tylenol, and that pain would have already been recorded. The nurse would hand the iPod to the patient with the headphones that had their music already pre-downloaded that they selected. The patient's pain would then be reevaluated at 45 minutes on using a pain scale of 0 to 10. The pain would then be reevaluated at 5 hours, at 10 hours, 24, and 1 hour before discharge. The patient would keep the iPod for however long they wanted to, and they would listen to the music for however long they wanted to. And that number of times that they listened to the music would also be recorded. And we would already had that presetted into the iPod, so we would know. And we can check that after they leave. The control group would also be receiving the same standard care, just without their intervention. And their pain would also be evaluated at those same intervals using the same pain scale. But the number of times that each patient received pain medication and the number of times that they received PRN medications would also be recorded no matter what group they were in. The data would be collected after each discharge and analyzed using a computer software. We would allow this experiment to continue until we reached our number that we generated from our power analysis. After the study was over, we would provide feedback to our staff nurses about what we learned in like a staff meeting, and we also provide feedback to our patients in a letter letting them know that they were also part of the intervention or if they were part of the control group, and how this affected their care, and how music actually helped them to heal faster or it didn't, depending on our experiment. And we would have this be mailed to their house. So limitations of our study for right now, obviously they're in the planning stages, so money and computer softwares and stuff like that, and where actually the experiment is going to be taking place are still limitations of the study. And then also the generalized population from just one hospital is another limitation.
So in conclusion, it is shown with all of our studies that combination treatment is more adequate at reducing pain in the postoperative patient than medication or pharmacological interventions solely. 4 of our studies used music therapy with medications to reduce the pain in postoperative patients, and we found that it was very useful, so we based our proposal project off of that, and we hope that one day something like our proposal project will be able to be used on a regular basis in the hospital setting to help reduce pain in all postoperative patients, if not even also regular patients.